So I'm working in a workshop on Lassa Fever. My target audience are adults, youths, and health workers. First of all, we want to understand what is Lassa Fever. Lassa Fever is an animal-borne or zoonotic acute viral illness. It is endemic in parts of West Africa, including Sierra Leone, Liberia, Guinea, and Nigeria. How is it transmitted? Transmission of Lassa virus to humans occurs most commonly through injection or inhalation. Mastomys rodents share the virus in urine and droppings, and direct contact with these materials through touching soil, objects, eating contaminated food, or exposure to open cuts or sores can lead to infection. Signs and symptoms. Signs and symptoms of Lassa fever typically occur 1 to 3 weeks after the patient comes into contact with the virus. For the majority of Lassa fever virus infections, approximately 80%, symptoms are mild and are undiagnosed. Mild symptoms include slight fever, general malaise, and weakness, and headache. In 20% of infected individuals, however, disease may progress to more serious symptoms, including hemorrhage, that is in gums, eyes, or nose as examples, respiratory distress, repeated vomiting, facial swelling, pain in the chest, back and abdomen, and shock. Risk and exposure. Individuals at greatest risk of Lassa virus infection are those who live or visit endemic regions, including Sierra Leone, Liberia, Guinea, Nigeria, and have exposure to the multi-mammate rat. Risk of exposure may also exist in other West African countries where mastomys rodents exist. Hospital staff are not at great risk for infection as long as protective measures and proper sterilization methods are at use. Lassa fever, I will talk about diagnosis. Lassa fever is most often diagnosed by using enzyme-linked immunosorbent serologic assays, ELISA, which detect IgM and IgG antibodies, as well as Lassa antigen. Reverse transcription polymerase chain reaction, that is RT-PCR, can be used in the early stages of disease. A virus itself may be cultured in 7 to 10 days, but this procedure should only be done in a high-containing laboratory with good laboratory practices. Immunohistochemistry performed on formalin fixed tissue specimens can be used to make a post-mortem diagnosis. How do we treat or prevent Lassa fever? Primary transmission of Lassa virus from each host to humans can be prevented by avoiding contact with mastomys rodents, especially in the geographic regions where outbreaks occur. Putting food away in rodents, proof containers, and keeping the home clean help to discourage rodents from entering homes. Using these rodents as a food source is not recommended. Trapping in and around homes can help reduce rodent populations. However, the wide distribution of mastomys in Africa makes complete control of this rodent reservoir impractical. Thank you very much for listening.